I'm Professor Tony Lawler. I'm the Chief Medical Officer for Tasmania, and also I'm the Deputy Secretary of Clinical Quality Regulation and Accreditation here within the Tasmanian Department of Health. So within my remit, I have oversight of safety and quality, clinical governance, emergency preparedness response, and also professional leadership within the health professions. And in that role, I have a close liaison with the University of Tasmania, where I'm also a Professor of Health Services and a proud alumnus of the Tasmanian School of Medicine. So the Tasmanian Collaboration for Health Improvement, I think, is an absolute key initiative of collaboration between the partners. It gives us an opportunity, I think, to really showcase what we can achieve in Tasmania. We have one health system, we have one primary health network, we have one university within the state, and partnering with consumers, clinicians and researchers, it gives us the opportunity to have a really strong focus on translational research to the benefit of the Tasmanian community. The Tasmanian Collaboration for Health Improvement is, I think, an example of where clinicians, researchers, academics and policymakers can work together to a common goal, and that is the improvement of health outcomes for Tasmanians and Tasmanian communities. We have no excuse really for not forming strong collaborations, and I actually think that TCHI gives us a central rallying point, as it were, for us to be able to identify the challenges that are faced by Tasmanian clinicians and the Tasmanian community, and actually target the research that we undertake. It gives us the ability then to link back into the provision of care, be that in the community, be that in our acute or subacute facilities, and really demonstrate how we can implement changes to evidence and practice, and also evaluate and demonstrate the benefit of those changes. So I think there are a couple of ways in which the Tasmanian Collaboration for Health Improvement can provide us with a significant change to what is happening now. Firstly, and I think not unimportantly, it's symbolic. It's symbolic of the collaboration that we have between the key players in the system. That's the Tasmanian government and all of its elements, being clinicians and clinician researchers, the University of Tasmania, the primary health network, and also, of course, and most importantly, consumers. What we're able to do is we're able to engage really closely with all of those elements and narrow the gap between them. It's very easy in Tasmania, and much easier, I think, in other jurisdictions, for different elements of the system to be working in silos. For individual players such as government or the academic sector or the primary health sector to see their aims as important and almost to the exclusion of others. We can't afford to do that in Tasmania. In Tasmania, we're a smaller population, we're much more closely linked. We do have our regional differences, but that also provides us with opportunities for trying different things. So in my view, the Tasmanian Collaboration for Health Improvement actually provides us with a way of bringing those groups together, breaking down those silos, and having a much stronger alignment, not only in the research agenda, but also in the clinical service agenda, and also recognising that when consumers use the health system, they don't see it as different elements. They see it as a single personal journey through the system, and we should be designing things and providing care on that basis. One of the keys that we have to have in research that is meaningful to the community, and we can talk about impact on the community of change in practice, we can talk about engagement of the community in clinician-driven research. I think one of the key elements is actually having the community contributing to the research agenda. I feel that we strongly engage the community through our partnership with community organisations and with the Consumer Health Forum. We meet regularly with all of the key partners, and one of the things that we need to do is to clearly understand not only what are the health drivers in terms of the burden of chronic disease, the ageing population, the rise in the demand on subacute and older person care, but also what are the elements within the community that are important to the community. So we can be driven by issues that relate to health service utilisation, issues that relate to how the community can better understand, access and benefit from different health services. So we look at health research in a number of different ways. We look at it in terms of benchtop research or basic science research. We look at it in terms of clinical research. But the other thing that we need to look at, and has been identified by the NHMRC as a key focus point, is health services research. How are health services structured? How are they accessed and understood by the community? How do we actually increase utilisation such that we're able to remove some of the latent inefficiencies of systems? So I think that we can't have that conversation unless we're actually engaging the community and consumers. Because as clinicians and as researchers, we understand how the system works. We understand to a certain extent where we see some deficiencies or where we see some inefficiencies and how we might improve them. We can focus very much on the new drug or the new treatment or the new device. But at the end of the day, how we structure and deliver health services needs to be based around the consumers. It needs to be based around clients or patients, however we style them, so that we can actually be comfortable that we're not only meeting demand, but we're also meeting community need. I see the Tasmanian Collaboration for Health Improvement as a symbol of a strong collaboration between the different elements of the health system. I know that we see, both nationally and internationally, at times we see competition between the different aspects. We see competition between the primary sector and the acute sector and the community sector. We see competition at some stages between government and the academic setting. In Tasmania, as I mentioned, we have one primary health network. We have one consumer voice body that we look to for its views on the health system. We have one state government and we have one university providing a broad range of undergraduate and postgraduate offerings, as well as a strong research output. If we can't do this well in Tasmania, I don't know where else we can do it well. The Tasmanian Collaboration for Health Improvement, I think, is a symbol of those strong collaborations that the different players can have. And that, I think, for me, is as a conjoint appointment with the department and also with the university, embodies for me the level of collaboration that I think Tasmania needs to improve health to the point where I think we can get to.